What if I told you the most dangerous moment of your life may happen in complete silence? It's 2:17 a.m. Your chest feels tight, not crushing, just strange. You think, maybe it's gas, maybe it will pass, but inside your chest, an artery is closing. Oxygen is disappearing. Heart cells are beginning to die. After 60, most fatal heart attacks don't happen in public. They happen alone. In bedrooms, in living rooms, in kitchens, no dramatic collapse, no warning siren, just minutes slipping away. The terrifying truth. The difference between life and death is not strength. It's what you do in the first 5 minutes. Tonight, I'm going to show you exactly how to survive a heart attack if you are alone, using science, not myths, calm action, not panic. Because your heart has beaten over 2 billion times for you, and it deserves a fighting chance. After the age of 60, a heart attack rarely announces itself with drama. It whispers. It disguises itself as fatigue. It feels like indigestion. It hides behind a slight pressure in the chest that you convince yourself is nothing. And while you hesitate, heart muscle is dying. Inside your chest, your heart has been beating faithfully for decades, more than 2 billion times without asking for thanks. But in a heart attack, one of the coronary arteries suddenly becomes blocked, usually by a ruptured plaque and a forming blood clot. Blood flow stops, oxygen disappears, and within minutes, the cells of your heart begin to suffocate. Cardiologists use a phrase that sounds clinical but carries terrifying weight. Time is muscle, because every minute that passes without restoring blood flow means more heart muscle dies. Research published in leading cardiology journals shows that during a complete blockage, up to 2 million heart cells can die every single minute. Imagine that. 2 million living cells lost every minute you wait. The first 60 minutes are called the golden hour, not because it is gentle or hopeful, but because it is your greatest chance for survival. If blood flow is restored quickly through emergency angioplasty or clot-dissolving medication, heart damage can be dramatically reduced. Survival rates increase. Long-term heart failure risk drops. Quality of life improves. But if treatment is delayed beyond that critical window, the damage becomes permanent and sometimes fatal. What makes this especially dangerous after 60 is that symptoms often change. The crushing chest pain seen in movies is not always the reality. In older adults, especially women, symptoms may be subtle. A squeezing sensation, pressure, pain spreading to the jaw or back, shortness of breath without exertion, sudden, overwhelming fatigue, nausea, lightheadedness, a sense that something is deeply wrong but impossible to describe. Studies from major cardiovascular research institutions reveal that nearly half of seniors who experience heart attacks delay seeking help because they misinterpret their symptoms. They wait, they lie down, they drink water, they hope it passes, and in that waiting, the heart suffers irreversible injury. Denial is deadly. The brain tries to protect you from fear by minimizing the threat. You tell yourself it cannot be your heart. You convince yourself you will call for help if it gets worse. But worsening can happen quickly. Electrical instability may develop. Dangerous arrhythmias can begin within minutes of oxygen loss. Ventricular fibrillation, a chaotic heart rhythm, can cause sudden cardiac arrest without warning. And survival from cardiac arrest outside a hospital drops dramatically without immediate intervention. This is why recognition is not optional, it is survival. If you are over 60 and feel chest pressure that lasts more than a few minutes or comes and goes, treat it as cardiac until proven otherwise. If discomfort spreads to the arm, neck, jaw, or back, do not rationalize it. If you suddenly cannot catch your breath while resting, do not ignore it. If you feel a wave of unexplained weakness unlike anything before, listen to it. Your body whispers before it screams. Medical data consistently shows that patients who call emergency services at the first sign of symptoms have significantly lower mortality rates than those who attempt to drive themselves or wait for family members. Emergency responders begin treatment immediately. Oxygen is given. Heart rhythm is monitored. Medications are administered on the way to the hospital. Every intervention buys your heart more time. There is also a profound psychological barrier many seniors face. The fear of embarrassment, the fear of being wrong, the fear of wasting emergency services. But cardiologists agree on one uncompromising truth. It is better to be wrong and alive than right and silent. Consider this. A blocked artery does not care about pride. A forming clot does not wait for certainty. Biology moves forward whether you act or not. The science is clear. Early recognition reduces infarct size, the amount of heart muscle permanently damaged. Smaller infarcts mean stronger pumping ability after recovery. Larger infarcts often lead to chronic heart failure, where the heart cannot pump effectively, causing breathlessness, swelling, and fatigue for the rest of life. The difference between those outcomes can be minutes. And here is something even more sobering. Many fatal heart attacks do not occur because treatment does not exist. They occur because treatment was delayed. Modern cardiology has advanced remarkably. Emergency angioplasty can physically open a blocked artery within minutes of hospital arrival. Survival rates have improved dramatically over the past decades. But these treatments are powerless if the patient never arrives in time. You must understand your personal risk. After 60, arteries naturally stiffen. Years of cholesterol buildup may have silently narrowed coronary vessels. High blood pressure injures artery walls. Diabetes accelerates plaque formation. Smoking damages the lining of blood vessels. Even chronic stress increases inflammatory chemicals that destabilize plaques. The event may feel sudden, but the process has often been building quietly for years. That is why awareness is not paranoia. It is preparation. Imagine this moment clearly. You are alone. You feel an unfamiliar pressure in your chest. It does not feel severe, but it does not feel normal. This is the decision point. This is where survival begins or ends. Do not test your strength. Do not lie down just for a minute. Pick up the phone, call emergency services immediately, put it on speaker, unlock your door, sit upright, slow your breathing. Those simple actions can preserve living heart tissue. Remember, heart muscle does not regenerate easily. What dies is replaced with scar tissue. Scar tissue does not pump. Scar tissue does not contract. Scar tissue weakens the entire system. But if blood flow is restored early, much of the threatened muscle can be saved. The heart can recover remarkably when given the chance. Every year, millions of people worldwide survive heart attacks because they acted quickly. And tragically, many do not, because they waited. You cannot control every risk factor. You cannot predict the exact moment, but you can control your response. After 60, knowledge is not optional. It is protection. Listen to your body. Respect new symptoms. Treat discomfort seriously. Call without hesitation. Because in the silent war between oxygen and time, the only weapon you truly have is immediate action. Minutes decide muscle. And muscle decides life. A heart attack does not only attack your arteries, it attacks your nervous system. The moment pain strikes, fear explodes. Your body floods with adrenaline. Your heart begins to race. Your breathing becomes shallow. Your blood pressure spikes. And in a cruel twist of biology, the very panic meant to protect you begins to make the damage worse. After 60, your heart does not tolerate chaos well. It has endured decades of pressure, stress hormones, inflammation, and microscopic vascular wear. When a coronary artery suddenly blocks, the heart muscle is already fighting for oxygen. If panic drives your heart rate higher, oxygen demand rises precisely when supply is cut off. That imbalance can accelerate tissue death. This is not motivational advice. This is physiology. When adrenaline surges, the sympathetic nervous system takes over. Studies in cardiovascular medicine show that acute stress increases myocardial oxygen consumption, raises blood pressure, and can destabilize heart rhythms. In someone experiencing a heart attack, this can mean a larger infarct size and higher risk of fatal arrhythmias. Calm is not weakness. Calm is strategy. Research has shown that controlled breathing can stimulate the vagus nerve, activating the parasympathetic nervous system, the body's braking system. When parasympathetic tone increases, heart rate slows, blood pressure stabilizes, and oxygen demand decreases. In simple terms, calm breathing reduces strain on a struggling heart. Picture this moment clearly. You feel tightness in your chest. Fear rises instantly. Your thoughts begin to spiral. Is this it? Am I dying? The mind wants to run, but your body needs stillness. Sit upright immediately. This position reduces pressure on the lungs and can ease breathing. Lying flat may increase discomfort and make shortness of breath worse. Loosen tight clothing. Open a window if possible. Give your body space to breathe. Now focus on one thing, your breath. Inhale slowly through your nose for 4 seconds. Hold for 4 seconds. Exhale slowly for 6 seconds. Repeat. Every slow exhale signals safety to your nervous system. Every controlled breath reduces adrenaline's grip. Clinical evidence supports that paced breathing can lower systolic blood pressure within minutes. It can reduce heart rate variability caused by stress. It can stabilize electrical conduction in the heart. When the heart is oxygen-starved, stability is survival, but calm action is not passive waiting, it is disciplined response. Call emergency services immediately. Do not attempt to drive yourself. Studies consistently show that patients transported by ambulance receive faster in-hospital treatment compared to those who arrive by private vehicle. Paramedics begin monitoring your heart rhythm on the way. If a life-threatening arrhythmia develops, they can defibrillate instantly. Minutes matter. Professional intervention saves muscle. While waiting for help, if you are not allergic and have no history of serious bleeding, chew a standard aspirin. Aspirin works by inhibiting platelet aggregation, preventing the clot from enlarging. Large-scale clinical trials have shown that early aspirin administration reduces mortality significantly in suspected myocardial infarction cases. Chewing speeds absorption. It is a small action with measurable impact. But here is what must be avoided. Do not attempt so-called cough CPR you may have seen online. Major cardiac organizations clarify that this technique is only appropriate in highly specific monitored hospital settings. At home, uncontrolled coughing wastes energy, increases oxygen demand, and may worsen instability. Preserve strength, conserve oxygen. Do not take a shower hoping to relax. Sudden temperature changes can shift blood pressure unpredictably. Do not drink alcohol to calm your nerves. Alcohol depresses the cardiovascular system and may interfere with medications paramedics administer. Do not lie down and hope sleep will fix it. Sleep cannot reopen a blocked artery. Every action during those minutes either supports survival or steals from it. Psychological studies reveal that perceived control reduces physiological stress response. When you focus on clear steps, sit upright, breathe slowly, chew aspirin if appropriate, wait for trained help, you shift from helplessness to action. That shift alone can reduce panic-induced adrenaline spikes. Remember this powerful truth. The majority of early heart attack deaths are caused not by the blockage itself, but by sudden electrical disturbances in the heart. Ventricular fibrillation can occur when stressed heart cells misfire chaotically. High adrenaline levels increase susceptibility to these lethal rhythms. Calm breathing lowers that risk. You are not trying to be brave. You are trying to reduce electrical chaos. Modern cardiology confirms that rapid reperfusion therapy, reopening the blocked artery, dramatically improves outcomes. But the bridge between symptom onset and hospital arrival is built on your behavior. If panic causes delay, the bridge collapses. There is another layer many do not discuss. Fear of dying alone intensifies panic. The mind races toward worst-case scenarios, but focusing on catastrophic thoughts raises cortisol and adrenaline even higher. Redirect attention to measurable actions. Count breaths. Listen to the operator's voice on the phone. Keep your mind anchored in the present. Neuroscience research shows that slow breathing can influence brain centers that regulate fear, including the amygdala. By controlling respiration, you directly influence emotional intensity. You are not helpless against fear. You can physiologically dial it down. If you have prescribed nitroglycerin for angina, use it exactly as your doctor instructed. Nitroglycerin dilates coronary arteries and reduces cardiac workload. But do not experiment with medications not prescribed to you. Precision matters in crisis. Calm action is about reducing oxygen demand while waiting for oxygen supply to be restored medically. It is about minimizing additional injury. It is about buying time for your heart. After 60, the heart muscle may already be less resilient. Aging cells recover more slowly from ischemia. That makes your early behavior even more critical. Panic increases workload. Calm reduces it. Panic accelerates damage. Calm slows it. Think of your heart as an engine running low on fuel. Revving it will not help. Idling it gently may keep it alive until help arrives. There is power in preparation. Practice slow breathing daily, even when healthy. Train your nervous system to recognize the pattern. When crisis strikes, familiarity reduces panic. Athletes rehearse for emergencies. Pilots train for engine failure. You can train your body to respond with steadiness instead of chaos. Calm action is not denial. It is decisive control in the face of biological emergency. In those terrifying minutes, you are not fighting the clot directly. Doctors will do that. You are fighting the secondary damage caused by stress response. And that fight is won with breath, posture, and immediate contact with emergency care. Your heart has endured over 60 years of life's storms. When crisis comes, give it its best chance. Sit upright, breathe slowly, chew aspirin if safe, wait for trained hands, reduce adrenaline, preserve oxygen. Because survival is not only about how fast the hospital works, it is about how wisely you act before you arrive. A heart attack does not begin on the day your chest tightens. It does not begin when you feel pressure in your arm. It does not begin when the ambulance siren echoes outside your home. A heart attack begins silently, years earlier, at the dinner table, in your bloodstream, inside the delicate lining of your arteries. After the age of 60, your arteries carry the story of your entire life. Every meal, every stressful night, every cigarette, every spike in blood sugar, every uncontrolled blood pressure reading. The damage is cumulative, and the most dangerous part is that you feel none of it while it builds. Inside a healthy artery, blood flows smoothly along a flexible inner lining called the endothelium. This lining releases nitric oxide, a molecule that relaxes blood vessels and keeps them open. But when you consume excessive processed foods, refined sugars, trans fats, and excess salt over years, inflammation begins to injure that lining. Microscopic cracks form, cholesterol particles slip beneath the surface, the immune system reacts, plaque forms. This is not theory. Autopsy studies have shown that atherosclerosis can begin decades before symptoms appear. By the time someone is 60, significant plaque buildup is common, even without warning signs. But here is the empowering truth. Plaque progression is not unstoppable. Daily habits can slow it, stabilize it, and sometimes partially reverse its impact. Consider extra virgin olive oil. In large-scale Mediterranean diet trials, participants who consumed olive oil rich in polyphenols had significantly lower rates of major cardiovascular events compared to low-fat diet groups. These natural antioxidants reduce oxidative stress, calm inflammation, and improve endothelial function. 1 to 2 tablespoons daily, drizzled over vegetables or legumes, becomes more than flavor. It becomes vascular protection. Fatty fish, such as salmon and sardines, contain omega-3 fatty acids EPA and DHA. These compounds reduce triglyceride levels, decrease inflammatory markers, and stabilize unstable plaques that might otherwise rupture. Plaque rupture is the trigger for most heart attacks. When a plaque tears, a clot forms rapidly, blocking blood flow. Omega-3s make plaques less likely to rupture. 2 servings per week can measurably reduce cardiac risk. Leafy green vegetables like spinach and arugula provide natural dietary nitrates. Inside your body, nitrates convert into nitric oxide, restoring some of the very molecule aging arteries lose. Nitric oxide relaxes blood vessels, lowers blood pressure, and improves circulation. Research shows that diets rich in green vegetables correlate with reduced cardiovascular mortality. A simple handful of greens daily influences chemistry at the level of your arteries. Oats contain beta-glucan, a soluble fiber proven to lower LDL cholesterol. LDL is often called bad cholesterol, but the danger lies not just in its level, but in its oxidation. Oxidized LDL embeds into arterial walls, feeding plaque growth. By lowering LDL, oats reduce the raw material for plaque formation. A bowl of oatmeal in the morning becomes a strategic defense. Nuts such as walnuts and almonds provide healthy fats, plant sterols, and magnesium. Studies demonstrate that a small, daily handful improves lipid profiles and reduces inflammatory markers. Walnuts in particular have been shown to improve endothelial function within hours of consumption. The impact is measurable. The benefit is cumulative. Garlic contains allicin, a compound with modest blood pressure lowering and cholesterol lowering effects. While not a replacement for medication, crushed raw garlic incorporated into meals may contribute to vascular health. Science supports small but meaningful improvements. Pomegranate is rich in polyphenols that combat oxidative stress. Oxidative stress accelerates plaque instability. In clinical observations, pomegranate juice consumption has been associated with improved carotid artery thickness measurements over time. 1 small glass of unsweetened juice can support antioxidant defense. But food alone is not magic. It is partnership. Blood pressure control is critical. Chronic hypertension damages artery walls, making them more vulnerable to plaque buildup. Studies show that maintaining blood pressure below recommended targets significantly reduces heart attack and stroke risk. Each 10 mmHg reduction in systolic pressure lowers major cardiovascular events substantially. Blood sugar management is equally vital. Diabetes accelerates atherosclerosis aggressively. Elevated glucose damages blood vessels through glycation and oxidative stress. Tight but safe glucose control reduces microvascular and macrovascular complications. What you eat daily directly influences this pathway. Physical activity transforms the heart from fragile to resilient. Even moderate walking for 30 minutes daily improves insulin sensitivity, lowers blood pressure, and increases nitric oxide production. Exercise enhances collateral circulation, tiny backup blood vessels that can partially compensate if a major artery becomes blocked. Think about that. Walking today could create life-saving alternate pathways in your heart tomorrow. Sleep is not luxury. Chronic sleep deprivation elevates cortisol and inflammatory markers linked to cardiovascular disease. Research shows that consistently sleeping fewer than 6 hours per night increases heart attack risk. Rest repairs the vascular system. Smoking cessation remains one of the most powerful interventions. Tobacco toxins directly injure the endothelium and accelerate clot formation. Within 1 year of quitting, heart attack risk drops significantly. Within several years, risk approaches that of a non-smoker. And here is the most striking fact. Many heart attacks occur not because plaques gradually close arteries, but because unstable plaques rupture suddenly. Stable plaques may narrow arteries without causing symptoms, but unstable plaques, inflamed and fragile, can tear without warning. Diets rich in antioxidants and anti-inflammatory compounds help stabilize these plaques, reducing the chance of rupture. Prevention is not about perfection, it is about consistency. Every healthy meal reinforces stability. Every walk strengthens circulation. Every night of proper sleep lowers inflammatory load. Every controlled blood pressure reading protects arterial walls. After 60, you may feel it is too late to change, but evidence shows that lifestyle modifications at any age improve outcomes. The human body retains remarkable adaptability. Arteries respond to improved conditions. Inflammation can decrease. Lipid levels can improve. Endothelial function can recover. The heart attack you fear tomorrow is influenced by the choices you make today. Imagine two arteries side by side. One inflamed, narrowed, unstable. The other nourished, flexible, supported by daily protective habits. The difference between them is not luck, it is pattern. Medication prescribed by your doctor, statins, blood pressure drugs, antiplatelets, plays a powerful role. Statins do more than lower cholesterol. They stabilize plaques and reduce inflammation. Combined with healthy diet and activity, they significantly cut cardiovascular events. Ignoring medication while relying only on food is dangerous. Partnership between medical therapy and lifestyle is the strongest shield. Prevention is not dramatic. It does not create headlines. It is quiet, repetitive, disciplined. It is choosing olive oil over trans fat. Choosing fish over processed meat, choosing greens over fried snacks, choosing movement over prolonged sitting. Each choice whispers to your arteries, stay open, stay stable, stay strong, stay. A heart attack feels sudden, but its roots are long. The tragedy is not that the event occurs without warning. The tragedy is that warning signs often exist in cholesterol levels, blood pressure readings, waist circumference, fasting glucose, numbers that reflect silent processes. Know your numbers, monitor them, act on them, because when the day comes that your chest feels tight, the strength of your heart muscle will reflect the years before that moment. Prevention is daily protection, and the meal you eat tonight may decide whether your heart survives tomorrow.